afternoon. I want to talk about something that many people don't really want to discuss, but it does happen in our families, to our friends, even to those sometimes we don't know. I just want to run through a little caption. I was here watching a video a while ago, and it drawn on me of something because I have a friend also that is in the same dilemma, or you call it being prognosed. We're talking about cancer. A lot of us don't realize that when you know someone who has cancers and it bothers you as well, it does. It truly bothers because my friend, I won't call her name, but I hope she's watching. You know, when she goes through the chemotherapy, I think she does it on a Monday. You can't visit her. It really drawn so much out of her. She's not a grumpy person, but on a Monday, I'm telling you, if you ever stop by, she's most grumpy. It saddens my heart and it pains me a lot. And I love this person very well. And, it hurts. It really hurts. I don't know much people that have to deal with it. And I pray every day and I hope that, there will be a cure for cancer, really a cure for it. I have searched here and I realized that a key factor, and I'm going to read from something that I'm having here. Cancer is a leading cause of death worldwide, accounting to nearly 10 millions in 2020, or nearly 1 in 6 deaths. I'm talking about a disease that has literally taken over the body, or maybe, wherever it takes it. Sometimes it's the foot and it affects every part, members of the body. And then, in this video, what I was watching, see a child had it, and in the school, she had to shave her head, and they were mocking her, in the school, especially a particular child was mocking her, in the school, and it really affected her so much. She felt as if she was alone. And then she had this friend with her who was, you know, siding with her. It takes a while for others to really be there and back you into it. There's another episode where a boy had it. His dad shaved his head. The boy was in school and others laughed at him. What kind of, I know this is a film, but people are going through these matters on a daily basis, whether it's a child or an adult. They're facing this. I remember, a time when someone called me from the island of Jamaica, where I am from, and was telling me about a little pickles in their breasts and that they had to go to the doctor about it. And I also remembered someone else called me that they were having leaking in the breast. And I also encouraged the person to go to the doctor, you know, and to find out what is the cause of the leaking of the breast and all this thing. We can't take this lightly. For those of you who be listening to me, you can't take this lightly. People are being affected by a lot of things. I agree with all that. But when it comes to cancer, mm, cancer can take any person at any time. You read about 1/3 of death from cancer are due to like tobacco use, you say eye body mass index, and eye body mass index and such like that, and alcohol consumption, low fruits and vegetable intake, and a lack of physical activity. In addition, air pollution is an important risk factor for lung cancer. You know, I am really particular in these things because why? According to doctor, I'm asthmatic, and sometimes coming up the stairwell or where I live, I'm on the fourth floor, and I don't have a lift to get up. And before I reach the second floor in this house, at times I am literally out of wind. And it's not joking, it's a serious thing. When I visit my son's home, there's because these are the older version of houses. But when I visit my son's home, and the second floor, I have no problem. I don't find myself have a problem going up the stairwell. You know, and these are the factors, when you think about cancer, someone lying in their home, cancer, someone in the hospital, cancer. You meet a fellow person on the road, in the tram, in the bus, and I can only use the means of method of transportation we have here in Switzerland. You see a person out there. Sometimes you look at the person, you start to give them a sort of name, and you said that they have some sort of disease that is catching. We gotta be mindful of the fact that there are people out there that are suffering in a manner that you they can't even explain to you what they're going through. And when I think about chemotherapy, I don't know the extent of which they go through with the body, what fluid may put inside the body to cause them to put a radiation in the body to kind of alleviate the tissues that have become malfunction that has caused the cancer, you know. But we laugh at people because they are sick. And it's painful. It's really painful. Sitting here and just watching this video, my eyes are filled with tears because I am looking at somebody I hold dear to my heart, and seeing at times how she, and it's a lady, she, how she slumbered down because of cancer. It had taken over the body. I think this is her third time it has resurfaced itself in the body, and she's going through all of this. It makes her want to be alone, and still that she want to be among others, but she kind of just draw back in herself because why? Who would understand the pain or the agony that she's going on in her body? It makes her lose appetites at times. And I'm still trying to look down in how what what causes it. How will doctors be able to fight this sort of disease that affect the person's body? In a way, a lot of us will say, oh, if God is God, why he can't help the people to get out of this? That's what a lot will say. My friend, we need to help. We need to be there with others when they are in this kind of situation. Don't look down on them. Don't think that you're in a better position than they are. Don't think it's some sort of generational curses that have caused them to have this sort of disease. I come to realize that a lot of us are afraid of sicknesses, but yet still when we ourselves become sick, we want others to pay much attention to us. Too many times we don't want people to talk about sicknesses. We don't want to hear about the sicknesses. We think it's some sort of taboo. But no, it is a factual thing in our midst. And cancer is one of them. Cancer causing infection, such as human papillomavirus, otherwise HPV, and hepatitis are responsible for approximately 30% of cancer cases in low and middle class homes in income countries where people don't have the money to get the right kind of therapy that they need. In this video, I'm trying to appeal to hospitals and doctors and family members and colleagues to stop being so narcissistic and let us try to see what we can do. Yes, we can't alleviate the pain. We can't let the cancer vanish. But we can help these people to live as normal as it possibly can. I agree that doctors are trying to figure out ways, but sometimes the in-depth of medications and the money that people have to pay, it's way overboard. It's too much. It's too much. And I hate to say this. Can the doctors find a way and a means or a method how to help these people that are infected with this cancerous disease? Yeah, I agree if some people can go out and make GoFundMe, but that is not enough. In the field of medicine, is there no one there who can come up to say, okay, let us find a way of how to treat these people without this luxurious money? Some folks can't afford it. I know there are countries that they have insurance, but the insurance can only go to a certain length. But what about those countries that do not have insurance to cover the cost for cancer in the throat, prostate cancer, whatever means of cancer there is? Can't the doctors? I'm calling out. I'm really touched today by something that I've watched. And yet still I speak to my friend on occasion, and I just can't really picture it, because when you're not in that position of certain things, you can't picture exactly what another person is going through. But something should tell us in our mind that they are feeling outcast. I'm looking here at the overview. Cancer is a genetic terms of a large group of disease that it can affect any part of the body. Other terms used are malignant tumors and non-neoplasma. I have no idea what all those terms mean. One defining feature of cancer is the rapid creation of abnormal cells that grows beyond their usual boundaries. That one I can understand. And which can then evade adjoining parts and the body and spread to other organs. You just imagine you woke up one morning, you head out to the dock. When you get there, after sitting down for quite some while, maybe even paying your money, you sit down and you get into the room with the doctor, and then he tests all the vital points. You go from one place to the other. They keep having you running all around the places. And then all of a sudden you are diagnosed with cancer of any part of your body. I remember my goddaughter's dad, who was diagnosed with cancer in the face. And they have this man coming every time. They couldn't find a bed to put him on. And when they decided to find him a bed, he was ready to go out of this world. It's sad. It's not just that Sometimes we might not know the person who have cancer. It doesn't matter. It's a disease that affects the body, and the person is literally deteriorating in front of your eyes. And then you have those who laugh. This video that I was watching, the child was laughing at the other and making a video of the person and the child, and the other child was saying that it will catch. The child was having a sort of drinking to help his system, because why, after chemotherapy, and I've witnessed this here, after chemotherapy, there is no lack. There is no way the body wants anything to really go down into the system. Chemotherapy literally is like depriving you from eating. She will sit down there and look at all the food, and she can find no appetite. I don't know who I'm sending this out there to, but I wish somebody would really start. I saw couple months back or a year, I'm not quite remembering the date or what, but when a young lady, they said that she had found a cure for cancer. I'm appealing to authorities out there. The money that we are spending to do something that is not necessary, why not start to focus it in on the health care, the health centers, in the health department, in whether we are in the low income countries or wherever. Just try to figure out and start to, you are scientists and you want to do all these millennium things and you want to be mega excellent and all this. Try to find a way how we can get this disease under control. You've put vaccination in people's body over the years, and I won't say I have a problem with all the vaccines. We have heard of people, because they have money, they get proper treatments. Their hair doesn't fall out, they doesn't lose their hair, they doesn't lose anything from their facial images. We don't know, because why? We are only looking on the outward appearance. But these people are suffering on the inside. We stigmatize them at times, because a lot of us, when you know that the person has cancer, you yourself are thinking that the cancer can just catch you over just by even looking at them. Some of you have walked away from families and friends because they have cancer. You start to put in your own word that this is the reason why the cancer has begun to eat on their inside. And you are not realizing that there's a tissue in you that can get out on one day and begin to even do abnormality in your bodies. One defining feature of cancer is a rapid creation of abnormal cells that grow beyond their unusual boundaries. That means it can happen to you, he, she, they, them, and the old ladies. It can happen to a newborn child as well as an older person, or we call it elderly. You can be fit to the bone, eat all the dietaries what you want to eat, and you're walking out there. One day you walk into the studio and they tell you that, oh my friend, something doesn't look right on you. The next thing, you stand in the mirror and you start to see that something has changed about you, and you run to the doctor and they diagnose you that you have cancer. Cancer in the throat, cancer in the breast, the prostate cancer. People have cancer in some areas of their bodies that I can't understand how this thing begins to happen there. But who are we to know until it begins to happen? And the doctors run their tests. You make one MRI after the other, and they still can't explain why the abnormality began to happen inside of you. My friends out there, I'm saying that we need to be a little bit more conscious of how we look at things and how we view people. And I'm still calling on the health department around the world. If it's the World Health Organization that can come up with something to help, because chemotherapy sometimes drain the body so much that those who are under the chemotherapy themselves as fall succumb to chemotherapy too many times more than the cancer in itself. And
It
you all,
drains the body. It deal with it mash the system of
you
your
see,
body.
exactly so, you
Yeah,
know,
you know.
and which can then invade adjoining parts of the body and spread to other organs. The latter
Yeah,
process is referred as a metastasis, where widespread metastases are the premium cause of death of cancer. You know,
yeah, yeah, yeah.
that's what we are saying. Steve, thank you, Steve Monrovia, for joining in. I thank you for your input. Yes, we people are suffering. People are, yes, the at the cost of the high cost of chemotherapy. Even the fact of the money itself has even caused more problem in the persons who are carrying the gene of cancer. This is not a joke business anymore. This is not something that we just sit down out there and just say, oh, they have cancer and the doctors can't do anything. We need somebody. Yes, we agree that there are factors, the real facts of saying something gonna bring us out of this life. But somebody needs to get back to the drawing board, unlearn what they have learned about chemotherapy, unlearn, do some other research and figure out a way of how. Yes, you are trained to save lives. It doesn't mean that lives won't be. You can't play God, so that doesn't mean that somebody won't go out. But get back to the drawing table, man, because I've seen chemotherapy destroying lives more than the person would say of the cancer in itself. To get a leg cut off because you have cancer. To have an organ in your body removed because you have cancer. Limb on your body or something, or a place begin to grow out of the proportion because you have cancer. It's one thing to see all the abnormalities, but then again, the price that is placed on this is extremely high for many, especially in low income countries. Not everybody have an insurance policy. When a young child as the age of 10, 11, 12, 13, you know, well, chemotherapy is a success in itself and it has a better survival than doing nothing while we don't have any other solution. Yes, that's what I'm saying. I'm not saying that the chemo doesn't help, sir. I'm not saying that. I'm just saying that for many, the price for the chemo alone is extremely high. The price that they put on, going every time for chemo is not cheap. No hospital give out chemo for free. The price is very high. Health in itself is a high cost. We all understand that.
Wow.
Thank you, sir. That's what I'm saying. Of course, low income situation, it's often not an option. That's what I'm saying. People don't have no, there should be something that can help folks who cannot. I'm talking in this country. I'm talking. It's like people. You have an health insurance, and people can The health insurance covers a certain cost. But what about the low income countries where a child has cancer? This child wants to go to school. This child has a dream, an aspiration. This child has great potential. But because the parent has not the money to help to pay for the cost of the chemo, yes, we agree sometimes the chemo is successful. Many times it drains the body. Well, I doubt cancer medication is really that expensive. It is expensive for those who do not have the money, sir. It is expensive for those who do not have it. Well, that's why I'm here, so I'm trying to touch somebody's heart out there to, we agree with all the big capitalism word of that, I'm trying to figure out how we can, touch some heart somewhere, where in, some places will be touched to, start to put back this on the World Health Organization table and to come up with some sort of, you know, an idea wherein the idea can become placed there in countries wherein medical teams can put every university of wherever that does all this thing. That's what we're talking about. We agree the end medication, for some it's too much. There are people who walked miles and drive to go, to see if they can get to do all the tests that they want. They have to go to one. It's not like some places they don't have an hospital that does all the things there. You have to go from one place to the other. So we are looking into all of that, and to let people be aware as well. It's more an awareness for people to realize that cancer is not something you taunt another person over. Cancer is not something that you look down on other people when they have it. Cancer is not something that you ostracize a person. You push them aside and just leave them there to rot. Cancer is something that we have to start to open up our eyes, and it's not a taboo, because out there a lot of folks have cancer. But the fact remains is sometimes the ones that are close to you, the moment they hear that you have cancer, they walk away and leave you there.
True, 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 true.
Times you go to hospitals in countries wherein, because you have cancers, the doctors themselves is that they close the door on you. And I'm not talking just because I want to talk. I'm talking from facts where it happens. And they just believe that, okay, you have cancer, so what? It's not cancer, so what? It's that these people need help, and they need your help as physician. That's why it says, when you're sick, you seek a physician. When you look at I'm reading something from here. It said the cancer is a leading cause. We talk about a worldwide death accounting to nearly 10 billion or 10 million deaths. And the most common in 2020 in the term of new case of cancer was, they said, the breast cancer. Breast cancer has 2.26 million cases. Lungs, we got 2.21 million cases. Colon and rectum cancer have 1.93 million cases. Prostate cancer among men, 1.41 million cases. And I'm reaching out to the men as well, that you gentlemen need to go and have your prostate, checked. A man over 40 years old ought to go to the doctor and have his prostate checked. sometimes even at 39, because it depends on how your body envelope. You have to go to the doctor. Would you mind turning off the volume because it's coming into the video? Put it on mute. You know, these things are happening. You have skin. The people the way I, we call them some names. I don't want to mention it like that. We have non-melonia. 1.20 million cases. These are people that are born with a different type of skin than ours. Sometimes they have to get special sun cream to put on their body. They have to refrain from, too much of the sun rays and all this. We have stomach, 1.09 million cases. These are all different symptoms of cancer, And we noticed that the most cases are the lung, the colon, and the rectum. We have the liver, we have the stomach, and we have the breasts. These are cancer places. Don't say, oh, I'm not sick. The time when you think that you become sick is the many time when a lot of you began to die. Yes, I agree that you can die even when you're not having any form of sickness in the body. But yes, you have to go and get your checkup. I remember a couple of years back, 2016, I think, I was in the hospital because of a cough that just come from nowhere. I remember later when the COVID got up, I was saying to my doctor, if that was when I had this cough, I would have been double quarantined. And I remember I met a woman there in the hospital, an elderly lady, very nice, decent lady. And she was on her way to travel outside of the pyramid of the country. And for holiday that she had not taken for how many years. And while she was at the hospital, while she was at the airport, I correct myself, that while she was at the airport, she eventually collapsed. And the nature of the collapse was that the two lungs were no longer functioning. They rushed her and she came to the hospital that I was in at the time. And she, we were staying in the same room together. Two persons could have stayed in that room. And after a while, we began to talk. And I remember her saying, her story that she was never really a sick person. She was not really a sick person. She was in her 80s. But the one time she got sick, because you have to say literally her last, the doctors gave her 6 months to the year that she would go. The two lungs had collapsed. They were saying she would, and she said no, she didn't want an operation. What it would cost, she wouldn't want an operation again because she was well in age. So, I'm still saying to every one of you out there, I agree. Some of you will say, I don't feel sick, I don't look sick. My capacity is good, my body's index is nice. Yeah, but you still need to get medical checkup. Don't wait till it's too late. We're in a time now when the mammogram should be going on. The men who are 40s year old and over should be getting their prostate check. Don't wait till it's too late. Not because you think, oh, I've been smoking for so many years, I've been drinking for so many years. Doesn't mean you can't go and check your liver and your kidneys. It doesn't mean that you can't go and get a colon and your rectum check. It doesn't mean you can't, because you think that, oh, I've given all the babies birth, or I've never given birth to any child. You can't go and check your stomach. Go to the gynecologist. Go to the neurologist. Go to all those big names, people. Find out where you can go get to the doctor. I agree. This is why I'm here. I'm saying that we wait too long. And by the time we wait that long, in that long period, we are way past helping. And those around us, that's a time when they walk away from you because they look at you that you are sick. You have no more use to them, which is a sad part of it, you know. And as we have heard, and I'm sure many of you can go up and research these things for yourself. Cancer arises from the transformation of normal cells into tumor cells in a multi-stage process. That general process from a precancerous lesion to a malignant tumor. These changes are the result of interaction between the person's genetic factors and three categories of external agent, including your physical corrosion, such as ultraviolet and ionizing radiation. It can cause by these things, chemicals, carcinogens as abstractors, components of tobacco smokes, alcohol, aflatoxin, a food contamination, arsenic, drinking water contamination. All these things can cause biological carcinogenics, where if I promise I don't call that name right, don't beat me up, such as an infection from various virus, bacteria, and parasites. The fruits we eat. I love when I'm on the island and I'll go to the mango tree and I will pick a mango. A lot of times never washed it. Just peel it, take your mouth, peel it off, and you begin to taste of the flavors and anything, and you begin to just eat it like that. And what many times we don't realize, on the mango on the outside, there's a lot of bacteria there, because while it's in the open, everything comes on it. And we just pluck it and we eat it. Our hands are already contaminated. I agree. Sometimes you keep your house too clean. That's what they say, you keep your house too clean. And why you keep it so clean, you also having bacteria because of the kind of chemicals a lot of you use to clean your homes. And you wash your clothes. A lot of places we have our clothes hang on the outside. Now let's say if you wash it in the wash machine, you can still have bacteria even though it washed in the machine. Because when you take it out of the machine and put it into the dryer, you're not sure if you had cleaned the dryer enough. So you took it from the 180 grad that is cooked in the machine and you put it into a dryer, especially the dryer is a shared dryer, what everybody else is used. It's not clean. Bacteria is there. People have washed their shoes there. Sometimes they wash the stuff from the dog, from the carpets, and then you put your clothes there, and you also have bacteria. Come again, we have a kitchen where we have, I wish this country I could cook outside on an everyday basis, because I believe that the food is properly cooked and on the stove itself, you know. And there are so many things. There are processed foods that we put in our bodies, and unprocessed food also we put in our body. So we have all these kind of things that can end up having bacteria and parasites. So there's a whole lot of things around us in the here and everything that we know of that can cause so many things to happen to our physical. And therefore, at times, we have to take in supplement. We have to get certain herbs and vitamins and all this kind of things to flush our systems at times, because you keep on eating from one month to the next to the next to the next, but you never flush your colon. You just keep on putting on in. Our physical, you forget to run. So many now begin, because they're driving, they never go again to walk. They never go to jog. All these kind of things begin to make a variation into your body. And you forget to walk. A lot of us, we sit before the television or the YouTube, or, we do all kind of things, but we forget to take care of the body. And these are many of the causes, how we have put our body system under a lot of strain. And yet still that's not the factor, because there are those already who have done all the therapies, the gym and all this, and yet still their bodies still come down to the fact that cancer is there. You can't be too careful, but you got to be careful. The World Health Organization, through its Cancer Research Agency, the International Agency for Research on Cancer, that is IARC, maintains a classification of cancer-causing agent. The incidence of cancer rises dramatically with ages, or from various age, most likely due to a buildup of risk for specific cancer that increase with age. The overall risk accumulated is combined with a tendency of cellular repair mechanism to be less effective as a person grows older. There's so many different kinds of things that they're saying, the causes. But I'm still reaching out to the World Health Organization. I'm still pleading to those who are in this position. Find a way how we can deal with those who have cancer. Yes, the chemotherapy. And put it in a way that when the doctors at time explain to the patient, because I tell you, sometimes the patient, they don't understand the big grammars. All they can know is that they are weak and they're sick. And then doctor comes up with some terminology that they have no idea. I agree, it's for each doctor to know how to deal with each patient. I'm just trying to help in a factor, in a way of saying that those of you who know you have family members, your friend, those who have cancer, let us be kind to them. Let us look at it differently, from a personal standpoint of saying it could be you. Those who are in the excess use of tobacco. Yes, you're smoking, but you find yourself, you reach to a certain age, or you start too early. Let us cut down on these things. Never been a smoker. I have drink on a couple of occasions, but not to say that I am stupid. alcohol consumption, unhealthy diet, physical inactivity. Wow, air pollution is a factor risk, because why? The air sometimes is so polluted around us. Even the drinking water that many catches on the outside is no longer what it used to be. The rivers have become polluted because of the toxic waste that we have disposed in the rivers. The very rivers that the water that we have to consume. They took the waste from factories and from our homes, and we deposit them in an unhumanly manner that is out there, and you don't realize that these put back in the body causes our body to malfunction. Some chronic infection are risk factor for cancer. This is particularly issue for low and middle income countries. Approximately 13% of cancers diagnosed in 2018 globally were attributed to these carcinogenic infections, including Helicobacter pylori, human Pampavilian virus, otherwise called HPV, hepatitis B virus, hepatitis C virus, and Epstein-Barr virus. These are all the kind of viruses out there. Hepatitis B and hepatitis C virus and some type of HPV increase the risk for liver, cervical cancer, respectively. Infection with HIV increase the risk of developing cervical cancer sixfold and substantially increase the risk of developing selective other cancers such as Kaposi's sarcoma. My friends out there, I'm bringing this to you, and I'm bringing it also to the World Health Organization. Please see what you can do to help those who cannot afford chemotherapy, but they have cancer. I'm also speaking to those who refrain from visiting the doctor. I'm appealing to the doctors out there who believe that it's only the money. I agree, the hospital needs the funds. I agree that you can't work free because you have studied for years and now you have become medicalized. So you can't give your labor for free. But I'm appealing to the heart of man to begin to treat patient differently. Some are burdened down, but help them to reduce the burden. I am appealing to those who, with kind heart, would go and make GoFundMe to help others. I must say that I appreciate each and every one of you. I'm talking to friends, family alike. Go and get yourself checked. To those of you who are listening, get yourself checked. Don't wait till it's too late. There are preventions for some of the things that affect our bodies. If you agree with me, I want you to share this to others. I'm not so great a motivational speaker. When things of concerns and matter arise, I'll put my voice within there to help to encourage others, to empower others to do that which is right. Let us start to be kind to each other. Let us start to be there for others when sicknesses arise. Don't turn your back on them. Sometimes you are the person that they need to be there with them while they're going through the agony and pain that is roaring through their body like wind and waves. And on this note, I want to say I thank those of you who have joined in. And I hope that you will be able to be strengthened, that others are out there rooting with you, praying for you, wishing you well, and trying to find a way out. They too can help you by speaking on your behalf. On this note, I'll say cancer risk can be reduced by not using tobacco, maintaining a healthy body weight, eating a healthy diet, including fruits and vegetables, doing physical activity on a regular basis, avoid or reduce consumption of alcohol, it is excessive, getting vaccinated against HPV and hepatitis B if you belong to a group for which vaccination is recommended. Avoid ultraviolet radiation exposure, which primarily resulted from exposure to the sun and artificial tanning devices, and or using sun protection measures. Ensuring safe and appropriate use of radiation in healthcare for diagnostic and therapeutic purposes. Minimizing occupational exposure to iodining radiation or reduce exposure to outdoor air pollution and indoor air pollution, including random radioactive gas produced from the natural decay of uranium, which can accumulate in building homes, schools, and workplaces. Early detection, cancer mortality is reduced when cases are detected and treated early. There are two components of early detection: early diagnosis and screening. Get your checkup. Get your checkup. Don't be too embarrassed to get your checkup. You know, sometimes you have some pimples growing somewhere and you decided to use pins and stick it. Be careful. Sometimes you have a tummy ache and it lasted more than the 48 hours or 72 hours, depends on how you feel the tummy ache. Go get checkup. I don't say everything you run to the doctor. Go get checkup. It's better to be early than to be late. On this note, I thank you again. From Zurich, Switzerland, I'm just a mediator, trying to do my best, the resources I have, to help you to find the cause of your problem before it gets too late. God bless you. How do I stop this now? Let me see if I can get. I am in, but how do I get out? Okay, I'm in. Just trying to see how to get out of here. While I'm out here, I'm just trying to say that please get yourself checked and get yourself trying to figure out how to come out. God bless you. Oh, yes.